Welcome to Part 2, Environmental Considerations. This podcast will be focusing on the question, what role do preventative actions play in enhancing the well-being of the athlete? At the end of this podcast, you should be able to evaluate strategies an athlete could employ to support the body's temperature regulation mechanisms, as well as to analyse the impact of climatic conditions on safe sports participation. By watching this podcast, you should be able to show an understanding of how the combination of heat and humidity or cold and wind increases the likelihood of hypothermia and hypothermia, respectively. Climatic conditions is the term with the broadest meaning in a sport context. The climate may be any outdoor or indoor condition that potentially impacts on performance. The climate will include prevailing weather conditions, the physical nature of the venue such as topography or altitude, as well as man-made factors such as pollution, traffic that impacts an event such as cycling, or noise such as stadium noise. We will focus on temperature, humidity, wind, rain, altitude, and pollution. Sports and performance injuries caused by thermoregulatory imbalance include heat exhaustion and heat stroke. These are serious conditions that are a result of dehydration, which develops when fluid loss is greater than fluid replacement. The prime cause of dehydration during physical activity is sweating. The body can lose 2 to 3 litres of fluid per hour through evaporation in hot conditions. Measuring weight and learning to monitor fluid loss accordingly in hot conditions of high temperature, 30 degrees Celsius, and high humidity, more than 90%, is important. Special precautions need to be taken with children as they are susceptible to heat loss. Children must be educated regarding the importance of fluid in the diet and its role in body functioning and temperature control. They should acquire the habit of having a water bottle with them and drinking water during play and training. The importance of wearing caps and hats for sun protection must be explained to children. These items are not only essential in avoiding skin damage, but also to prevent exposure to direct sunlight, which can cause heat illness. To prevent dehydration and hypothermia, use a range of strategies to hydrate. Athletes should hydrate before, during, and after physical activity, referring to the guidelines for fluid intake. Drink every 15 to 20 minutes while running. Drink water or low carbohydrate concentrate sports drink. Wear clothing that breathes. Avoid activity in times of high temperature and high humidity. Avoid 2 consecutive days of competition or training involving heavy fluid loss. Avoid excess fat and salt, alcohol and coffee, which act as diuretics, which increase the production of urine and therefore promote fluid loss. An athlete should not run if suffering from a fever. Athletes should also try and make sure that they're training properly and acclimatised to race conditions. And athletes need to learn to recognise the symptoms of dehydration. For example, increased pulse, core body temperature, decreased blood pressure, water in cells and gradual decline in circulatory functioning, chilling, unsteadiness, dry skin, loss of focus, and profuse sweating. Biometric equipment can help monitor blood pressure and core body temperature. Rain can affect temperature regulation and impact on safe sports participation in a variety of conditions. For warmer weather, rain may help with temperature regulation. For colder weather, rain will lower core body temperature. Rain affects an outside playing surface for an athlete. Conditions become slippery, which increases the risk of injury due to falls, collisions from not being able to stop effectively, and lack of control of sporting equipment. Wind is also a factor to be considered in heat loss. The combined effect of convection and conduction contribute to wind chill. This burning sensation on the skin can be further accentuated by increased cloud and humidity. Light clothing that covers most surface areas during running and cycling, wetsuits for surfing, full body ski suits and face goggles are examples of attire used to prevent wind chill. Activities such as skiing, surfing, running, cycling and scuba diving may occur in cold conditions. These are conditions that cause loss of body heat to the extent that the ability to maintain heat balance is jeopardized. Internal body temperature decreases in excess of 1 degree Celsius result in activation of heat conservation mechanisms, shivering, and peripheral, which means on the skin and at the extremities, vasoconstriction. Shivering will increase heat production, while peripheral vasoconstriction will decrease blood flow to the skin. Athletes exercising in the cold should be aware of how much clothing is appropriate to the activity. Athletes should not overdress because excess clothing stimulates sweating. The moisture evaporates, taking heat with it, causing the body to rapidly cool and chill. In cold environments, athletes with higher amounts of subcutaneous fat will have protection and thereby lose heat more slowly. Children are more susceptible to heat loss than adults are. At altitude, the percentage of oxygen in the air remains at approximately 21%, but the number of oxygen molecules per unit volume decreases. This means to receive the same number of oxygen molecules in a breath of air that we receive at sea level, we need to breathe more air in. Lack of oxygen is the number one cause of health problems at altitude. Normally, oxygen diffuses from the alveoli into the blood because gas pressure is greater in the alveoli than it is in the blood. This is what we remember as gaseous exchange. At altitude, diminished air pressure reduces the pressure in the alveoli and decreases the amount of oxygen diffusing into the blood. This is known as lowered partial pressure. At sea level, the blood is saturated with 95% oxygen. At 5,500 metres, however, it is only saturated to 71%. This lowered partial pressure of oxygen results in hypoxia, which means a lack of adequate oxygen. This is the condition that will eventually stimulate the acclimatisation process. Athletes who do not acclimatise are at risk of certain altitude sicknesses. The three most common are acute mountain sickness, high altitude cerebral edema, and high altitude pulmonary edema. The symptoms for acute mountain sickness include headache, lethargy, lack of coordination, appetite loss, dizziness, nausea, and vomiting. High altitude cerebral edema, which means that the athlete is suffering from fluid within the brain, has various symptoms including severe headaches, visual disturbances, irritability, vomiting, vagueness and confusion, possible unconsciousness, and convulsions. Athletes suffering from high altitude pulmonary edema, that is fluid within the lungs, experience symptoms such as breathlessness, heart palpitations, blue-tinged skin owing to a lack of oxygen, this is known as cyanosis, frequent coughing because of the fluid on the lungs, irrational behaviour, and the inability to sit up or walk in a straight line. Pollution can affect an athlete's breathing by reducing the amount of oxygen the athlete can breathe in. Oxygen is essential when exercising, especially for aerobic exercise. In the short term, symptoms may include coughing, wheezing, watery eyes, and a feeling that breathing is restricted. Exercising in hot human conditions, when the body is not accustomed to it, can place the body under great stress. The demand for circulation to working muscles which are producing heat overtakes the need for blood flow to the skin to transport heat away from the body. As a result, body temperature rises. Couple this with dehydration and the risks of heat illness, and poor performance increases. Athletes travelling overseas or to different climates should consider heat acclimatisation an important preparation strategy. For acclimatisation to occur, there are certain choices available to an athlete. Live and train in the hot environment where the sporting environment will be held. Live and train in another location, but with an environment similar to the host location. Or stay at home, but create a hot training environment in a laboratory, for example, with internal heating and warm, heavy clothing. This offers a more controlled environment with little disruption to training and less time away from home. The Australian Institute of Sport advises that athletes should plan for acclimatisation, especially if competing in hotter environments than athletes are used to, Either arrive earlier to allow 2 weeks for acclimatisation, or commence the process before they leave home by exercising in a hot environment or wearing heavy clothes in a cooler environment. Consider the frequency of exercise, duration, intensity, and the environmental conditions needed to sufficiently elevate core body temperature and invoke a sweating response necessary for heat acclimatisation. Monitor their hydration status by body weight or urine colour and volume. Ensure that they drink sports drinks to maintain hydration and replace sodium lost in sweat. And finally, carry drink bottles at all times so that drinking regularly becomes a habit in hot climates. Cold weather may be accompanied by snow, unlike hot weather, which requires the gradual immersion of the athlete into the hostile environment. Cold weather conditions require the creation of protective clothing barriers that keep the environment out. Layered clothing with an inner polypropylene layer that will wick or direct perspiration away from the skin of the athlete is of critical importance. The greater the amount of water at the skin, the lesser the thermal or warming quality of the skin and the clothing next to it. Training in cold weather is less important to the acclimatisation of the body than in warmer weather. Cold weather can also present hydration problems, as the energy generated in the activity and fluid loss to perspiration are less apparent but equally impacts on the body. Acclimatising to altitude include training should be at moderate altitude of 2,000 metres. Short exposure to higher altitude should be included regularly during training. And altitude exposure should be limited to periods of 2 to 4 weeks with intermittent trips to sea level to ensure maintenance of muscular power. An athlete is adapting to altitude when the following physiological changes begin to occur. The first is increased pulmonary ventilation or increased respiratory rate. This occurs usually within a few hours. It becomes more pronounced within a few days and stabilises after about a week. Both the rate and depth of respiration increases in response to the lower concentration of oxygen, causing more carbon dioxide to be lost and more oxygen delivered to the alveoli. Increased heart rate. Cells require a constant supply of oxygen, so the heart beats more quickly to meet the demand. Except at extreme altitudes, heart rate returns to near normal after acclimatisation. Increased blood cell production. As acclimatisation continues, the bone marrow increases red blood cell production. New red blood cells become available in the blood within 4 to 5 days, increasing the blood's oxygen carrying capacity. An acclimatised person may have 30 to 50% more red blood cells than someone at sea level. And finally, an increased number of capillaries. The body develops more capillaries in response to altitude. This improves the diffusion of oxygen by shortening the distance between the cell and the capillary. The stress caused by hypoxia is similar to that caused by physical training. Total blood volume, hemoglobin, red blood cell count, mitochondrial concentration have all been enhanced by both types of stress. Altitude may be of greater benefit to untrained athletes, as a trained athlete may not be able to sustain the intensity and duration of their normal training at altitude or fail to acclimatise and therefore struggle in training and competition. The current thinking is that athletes should train low and live high to overcome this problem. This means that they need to develop some practical strategies to help overcome this problem. These strategies include using a hypoxic training system like a hypoxic tent, or training in a specially designed laboratory that mimics training and living at altitude. In general, the body becomes 80% acclimatised after 10 days at altitude and 95% acclimatised after 6 weeks. Respiratory rates peak in about 1 week and then slowly decreases over the next few months, remaining higher than that at sea level. After 10 days, the heart rate starts to decrease. The longer you remain at altitude, the better your performance becomes, but never quite reaches the values at sea level. Improved performances come about because of acclimatisation.